So this is a patient, age 22 years, with the complaint of weight loss and epigastric region pain for the last few months. There are no laboratory findings available and or clinical notes or any other imaging material is provided. So I have placed the probe in the epigastric region and we are going to scan, and here we see on the ultrasound that this is the pancreas in center. This is the transverse section. This is the transverse section of the pancreas. As we can see, the landmark for the pancreas is clearly seen, identified along with the rest of the central anatomy. Now this region is that of the pancreas. This is the pancreatic body. This region. This is the pancreatic body, and this is the head of the pancreas. In transverse section though, this is the pancreatic head, this area. This is the splenic vein, this black tubular structure was running posterior or coursing posterior to the pancreatic body. This is splenic vein. Now this is the aorta. This is the inferior vena cava, IVC, in transverse section, and this area, small, tiny, cystic area that you are seeing, is the superior mesenteric artery in transverse section. Okay. Now this is a region. This is a hypoechoic area. This is a hypoechoic area, well demarcated, and measures 18.3 into 8 millimeters, and there is another well demarcated hypoechoic area at the right parapancreatic region. Now these two areas, this one and this one, these are the lymph nodes, enlarged lymph nodes. N will mean node. So there are two lymph nodes seen in this plan, whereas now this vessel that is coursing anterior to the aorta is the left renal vein that is entering the IVC. So this is the plan, and here you can see that this is the superior mesenteric artery. Now, with little maneuvering, I can see another hypoechoic, well demarcated area posterior to the body of the pancreas. Now this is the lymph node, this one, measuring 3.1 into 1.8. This is the pancreas, and now you see that the head of the pancreas, now this is the longitudinal section of the pancreas, and you can see that the head of the pancreas is surrounded by multiple lymph nodes, enlarged lymph nodes. Now This is the aorta in longitudinal section. This is the sphenomesenteric artery arising from it. Now what is this? This black, well circumscribed area. With this is the left lobe of the liver in longitudinal section. What is this longitudinal area? So this is the portal vein here at the region of the porta hepatis. This vessel is the portal vein. Okay, and you can see that anterior to the portal vein, this is the region of the porta hepatis. This is portal vein, left lobe of the liver in the longitudinal section. This is the common bile duct. Now this is a lymph node. Again, this is a lymph node. This is a lymph node. Whereas this is the IVC in transverse section. Now you see that this is the aorta, and this is the celiac trunk, and this is the left gastric artery, this is the splenic artery. When I say that this area is a lymph node, and if it is a lymph node, it should not change its shape a lot, much, you know. This is the...
खत्म हो रही है
कितने?
एंड
Okay. Now, if this is a lymph node, this area, it will not change its shape in a tubular structure. This is a lymph node. See, I am going to rotate the probe and it retains its shape. I have almost given 90-degree sweep. It retains its shape. So there are multiple lymph nodes at the parapancreatic region, right parapancreatic region, whereas the duct of the pancreas is normal. You can see this is the duct. This is the duct. So there are multiple lymph nodes in the parapancreatic region as well as in the right paravertebral location. This is how you study the adenopathy. The vascular studies are very important. Now you see, if this area looks like a lymph node, and this one is again a lymph node, this area. This is the inferior, this is the caudate lobe, this is the ligamentum venosum, this is the IVC, and this is the lymph node. So there are multiple lymph nodes seen. Now pancreatic tissue is here. This is the pancreatic tissue. When I move the probe anteriorly for capillary, I see a distinct hypoechoic area which is an enlarged lymph node. What about this area? This is an enlarged lymph node. This is the aorta. See, it does not change its shape much. The lymph nodes will retain their shape. In all cases of adenopathy, we should see the spleen, especially when the lymph nodes are in this region. The spleen is normal. This is the spleen, measures 9.7 millimeters. Okay. This is the portal vein. This is the gallbladder, and you can see this is the lymph node again at the region of the porta hepatis. I am moving the probe, and it is not changing its shape. Now there is one more. This is the one which I am talking about. I'm giving full sweep to the probe and it retains its shape. So this is another lymph node at the region of the porta hepatis. Now this is a lymph node, this area. This is the lymph node. It retains its shape.